Welcome to the UNM Healthcast. My name is Elizabeth Dwyer Sandlin, and today for Heart Month, we are talking with Dr. Abinash Achrekar, cardiologist at UNM and vice chair of the Department of Medicine. Thank you so much for joining us today. We're really glad to have you.
Great. Thank you for having me. I appreciate it.
Yeah, you bet. So February is known for all kinds of heart-related things because hearts are associated with love and it's Valentine's and all of those things. But it's also the American Heart Month. So raising awareness around heart health and what it means to keep your heart healthy, tips to do that, and things to look out for in terms of when your heart might not be doing so great. So today we're just going to chat a little bit about the heart, and let's start with the good things. What are some things we can do to keep our hearts healthy?
That's a really good question. Yeah, February is the American Heart Association Heart Month, probably because of Valentine's Day. But, this is probably a cliche, but every month should be Heart Month because, most of us have hearts, and most individuals still pass away from cardiovascular conditions in this country. Prior to being the vice chair at the Department of Internal Medicine, I was the American Heart Association president here in the state for about 5 or 6 years. And so we did a lot with advocacy, a lot with prevention, and then a lot with diagnosis and treatment, which the University of New Mexico was really instrumental in. I like to tell my patients now that 80% of heart disease is actually preventable. So we have a lot of diseases nowadays that are not preventable. There's many cancers that are just genetic. They're not preventable. But the preventable things, we really should try not to get them. So 80% of heart disease is preventable. But the problem is the prevention needs to be a lifelong process. It can't be after the proverbial train has crashed and then we're going to try to prevent stuff at that time. As a cardiovascular physician, I usually deal with that proverbial train crash. After somebody's had a massive heart attack or a stroke, they end up in the hospital. And with current technologies and, exemplary care, we can get a lot of patients through those events, but there will be lifelong damages to them. So we really try to prevent cardiovascular disease. And the way we do that is the American Heart Association has this system called Life Simple 7. And it's about living a healthy life, for many, many years to try to prevent cardiovascular disease. And those things are knowing some of your numbers. And those numbers would be, what is my blood sugar? What is my cholesterol level? What is my blood pressure? Those are kind of knowing your numbers. There's data out there, Elizabeth, that says just knowing your number reduces your number. So if you never get checked, you're never going to know, right? And so if you go to your primary care provider, you go to an urgent care, even an ER, you will be able to get some of these numbers. And just knowing those numbers starts the process of reducing those numbers. So that's 3 of the Life Simple 7. But then the other ones are on the onus of the patient. Eating right with a heart healthy diet, and you can look that up on the American Heart Association website as well. At least 30% of Americans are obese or overweight. That number is growing probably in some parts of the country. Over 1 in 2 are obese or overweight. They're also so that's 4 and 5. Number 6 is to get moving. Exercise is recommended, and everybody's like, well, how much exercise should I do? The recommendations are surprisingly low. So, and the reason that I want to say that is I think there's a lot of intimidation about, well, what do I need to do to get in shape? And I think now, in the last couple of years, we've had more inclusive workout environments. Back when I remember exercising, I felt intimidated going to the gym because I wasn't in shape. Right. But the recommendations nowadays are about 30 minutes of moderate physical activity 5 times per week. So, but if you're going to do vigorous physical activity, it's going to be less minutes than that. And then finally, and this is like the obvious thing, is to stop and curtail smoking and vaping.
Sure. So vaping, I just want to make sure folks hear that part, because I think there are a lot of folks who vape instead of smoke, thinking it's somehow better for you, but you included those together.
Yeah, I did. And so, prior to this current position I've had, I also told you I was the American Heart Association president, but I was the state health official and the deputy cabinet secretary. And while I was there, we actually passed comprehensive tobacco reform. So we increased the age of buying tobacco products. And in the state of New Mexico, we included vape products in those tobacco products. So you have to be over the age of 21 now to purchase tobacco and vape products in the state of New Mexico. So that's because we think it's so important to not even start that habit. There's a large amount of data out there that says that if you begin vaping at a certain age, you will convert to tobacco use in a certain amount of years after vape use. And we know that cardiovascular disease is associated with vaping as well. We weren't going to really talk about COVID, but there are data out there to say that those that vape have twice the chance of actually getting COVID than those that don't vape.
Whoa.
So, and those that are vaping are usually our younger population, and so we really want that to be known.
Yeah, that makes a lot of sense. Just to backtrack to the exercise portion, when you say moderate physical activity, is that like going for a walk, doing some yoga or stretching? Like what counts as moderate?
So I think, well, we usually talk about cardiovascular, activity. So some yoga could be cardiovascular activity for sure. But to make it so simple, I try to tell my patients, because many patients aren't active at all. And the ones that are the least active don't require much to get active, because they're so sedentary. But we usually say taking a brisk 30-minute walk where they are unable to, carry on a conversation with their partner, like they're breathing hard enough. So, and that's like for 30 minutes of continuous walking. So that's probably a moderate to fast pace of walking. And I try to tell my patients they should be a little tired, and they should be a little short of breath where they're not able to complete sentences with the partner that they're walking with. And that means they're actually huffing puffing.
That makes sense. I had a doctor tell me once, when I was concerned about, I had a new baby and I didn't know how I was going to get physical activity going. And she said, make a playlist of like your favorite songs to dance to, and then just dance around your house. And I felt like, oh, that seems so simple. Does that really count? And she was like, is it hard to talk after you do that? And I was like, yes. She said, then it counts.
Absolutely. That's about it. Like I try to run on a treadmill because it's been so cold, and I try to just put like a 25-minute like show on Netflix. And I'm like, I'm just going to run till this show's over. I was going to watch the show anyways. Let's be clear. I might as well be running when I'm watching it.
Yeah, that's a great pro tip. So you can get your TV and your exercise in at the same time.
Yeah, exactly.
So you mentioned that folks are still dying from heart disease and other heart issues, a lot of which are largely preventable. Can you talk a little bit about what is heart disease and risk factors associated with them? I know we already talked about smoking and being sedentary, but anything else that you might want to mention?
Yeah, I mean, heart disease, like I said, most Americans will succumb to heart disease at some point in their life. It's still the number one heart disease, and I'm including stroke in there too. It's cardiovascular disease. They will succumb to that. It's rapidly decreasing. Cancer is still a number 2 cause of death in the country behind cardiovascular disease. We've made huge strides with cardiovascular disease because, as I said, 80% is preventable. So if we keep on working on these things, ideally, I'm out of a job in 10 years, right? Because it's preventable disease. We're not really going to need this. But, I say that with a grain of salt. But the risk factors are high blood pressure for sure. We should really talk about high blood pressure for a couple of minutes. The U.S. Surgeon General, the current U.S. Surgeon General, he has a program because hypertension or high blood pressure is known as the silent killer. This is a surprising statistic. 1 in 2 Americans, adult Americans, if we remove children, 1 in 2 adult Americans have high blood pressure.
Wow.
So that is an enormous amount of people. That's more than any cancer out there. That's more than any other disease out there. That's more than COVID. 1 in 2, that's even more than obesity. 1 in 2 Americans have hypertension. And hypertension is clearly linked to cardiovascular disease, stroke, and heart attack. So to get blood pressure under control, remember the first thing we said is just know your number. So if you know your blood pressure is elevated, it's going to start working on your blood pressure because you're going to be conscious of it. And but the other frightening statistic from the US Surgeon General's office is only 1 in 4 Americans have even the blood pressure under control, 1 in 4 adult Americans. So
Wow.
that's an enormous amount of people that have a significant risk factor that we can treat that would prevent their heart attack or stroke. And so the way to do that is check your blood pressure with a clinical provider, your PA, your nurse practitioner, your primary care provider, your medical doctor. And then we usually begin with what we call therapeutic lifestyle changes, changing our diet. Sometimes a low salt diet can help. Exercise clearly lowers blood pressure. So your blood pressure elevates when you're exercising, but if you exercise on a regular basis, your resting blood pressure is much lower. So that's a treatment as well. And then weight loss is very important for blood pressure as well. So high blood pressure is a risk factor for heart disease, high cholesterol, and diabetes, and following your sugar. So those are the kind of things that should happen in regular checks for our adult patients.
So what are some common misconceptions about heart health? Like, why are these numbers so big that you mentioned? Why do so many people have a preventable risk factor sort of, secretly at play?
Well, I think that you hit it. It's secret, like you don't see high blood pressure, you don't see high cholesterol, you don't see high sugar, or diabetes, or glucose intolerance is what it's sometimes called if it's not full-blown diabetes. These are risk factors that are kind of starting probably sometimes in our late teens and really not causing any outward signs till our 40s into our 50s. And the unfortunate part is the first diagnosis of heart disease in about a third of our patients is massive heart attack. That's the first presentation. The others may have chest pain and what we call angina, but not a massive heart attack. And others just get diagnosed by, getting non-invasive testing. All of those risk factors, I guess, other than the obesity and sedentary life, are hiding inside of our bodies. And so that's why regular screenings by primary care providers are incredibly important, and regular wellness checks. We send our kids for wellness checks all the time. But even at my age, I'm almost 50, I'm 47, I think. Most of my friends are like, when should I see a doctor? I'm like, you should have been seeing a doctor once a year, since you were an adult. So I don't think we think about it in such a way, but this is why American Heart Association Heart Month is important. It's to raise awareness and advocate for, prevention and seeing our primary care doctors and addressing these concerns before they're a problem.
Okay, so we've talked about prevention. We've talked about things folks can do to help take care of their hearts. What if that doesn't happen and then things start to go wrong? What are some signs folks should look out for that something's wrong with their heart, like heart attack, stroke, etc.?
These are great questions. And these are probably the most important in what we call the chain of survival. The chain of survival is when somebody has a symptom and then they activate 911, the EMTs come, they finally end up at the University of New Mexico Hospital on our cath table. That's the entire chain of survival. And we've realized that the chain of survival has the highest survival is if that time is the shortest. We don't delay any one part of that chain. And so the first part of that chain is a patient or a patient's partner, friend, loved one calling, activating 911. So the question is, when do they do that? So when you have a heart attack, when most people have a heart attack, it usually is associated with some chest discomfort, chest pressure. Sometimes there's discomfort in the upper shoulders or arms. It can be associated with shortness of breath, cold sweat, nausea, sometimes even vomiting. For a long time, a lot of the data about what a heart attack was came from Caucasian men, which is what we studied in the past. And quickly we realized that our country is very diverse, and we definitely have women, and we're not all Caucasian men. So different ethnicities present slightly differently. I would say, I don't want to make huge generalizations, but women have what we call atypical symptoms. So they may not have the chest pressure. They may be associated with extreme fatigue. And this is beyond just the, I'm tired, I think I need a nap, or this is like the chronic kind of tiredness. This is like such fatigue that they would get winded going to the bathroom or taking a shower or getting up to get a glass of water. So that could be an atypical sign in a woman that they're having a cardiac event. Stroke is the other concern that we have, and stroke is the chain of survival for stroke needs to be even shorter. We really try to treat stroke within 3 hours of the first symptom.
Wow.
And that's really hard because most of the time people have spent 8 hours at home. So, so we really want, and you've probably seen some of the billboards that were out there, like there's an acronym called FAST out there. Facial drooping, a patient doesn't have an equal smile. If they have arm weakness or a weird sensitivity in either arm, if their speech is garbled, and finally, the T is for time to call 911 if any of those things occur. And like I said, the chain of survival for stroke is much shorter. So we need patients that have any of those symptoms to immediately activate 911.
That makes a lot of sense. There was a pop culture phenomenon recently in the reboot of Sex and the City, where in the pilot, Carrie's husband dies of a heart attack and she just sits there holding him while he dies. And everyone's like, why didn't she call 911? He did not have to die. They talked to a cardiologist. He was like, that's a tragedy. They were 8 minutes from a hospital. He could have lived. So teachable moment for everyone. It was really present in the zeitgeist. So we've got signs of a heart attack, signs of a stroke, ways to prevent heart disease and other cardiac events. In this month of heart health awareness, what is the most important thing that you want people to know and to absorb and carry with them throughout their daily lives?
That's a really good question. I think there's two things. One, that heart disease is preventable and stroke is preventable. If they follow the Life Simple 7, that's number one. But number two, every one of us citizens out there can help in that chain of survival. So a couple of years back, this was when I was the president of the American Heart Association here in the state, we passed CPR as a high school graduation requirement, hands-only CPR. And so high school students that are at public schools are required to know hands-only CPR, because activating 911 is the first step, but the second step is maintaining that patient's perfusion or blood pressure as much as possible with hands-only CPR. So hands-only CPR can be taught, but it's pretty simple. The American Heart Association also has links on watching videos, but basically the recommendation is to push hard and fast in the center of the chest. And we actually say at a beat of 100 beats per minute. And it's kind of funny, but when you're training in CPR, they play that music, I think by the Bee Gees, Staying Alive, Alive. And they're like, da, 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 and that beats about 100 beats per minute. And that's what they say, push hard and fast at that beat in the center of the chest till the EMTs arrive or the paramedics arrive. So those are the two important things. This is preventable. And if it isn't prevented, there's something all of us that can do something about it.
Staying alive. That's very catchy and easy to remember. So that works out great. I have to ask, just because you haven't mentioned it, and this might be a very old school thing, but I just want to follow up for folks who might be wondering as well. Is aspirin still a thing? Do you give someone aspirin if you think they're having a heart attack, or is that no longer?
No, we absolutely do give people aspirin. If we think people are having a heart attack, 100% of people need to get aspirin unless they're allergic. The only controversies that we've seen in the press is, do you need aspirin if you're not having a heart attack? Right. For prevention.
Right.
So there are a vast majority of people still need aspirin. Like if you've ever had a heart attack, you're always going to be on aspirin. If you have other risk factors, like cholesterol disease, if you have high blood pressure and evidence of other kind of vascular disease, you probably need aspirin. But what we've learned is we just don't. Before, we used to give every adult aspirin, period. But we realized, anytime you do that to any population of people, it's not the ideal thing to do. So we've actually, started to decrease the prescriptions of aspirin in prevention of heart disease. But for treatment, it's absolutely essential. It's the first medicine that we give.
Okay, good to know. Thank you so much for talking with us today. This has been really informative. I personally, as a woman, am extreme fatigue, didn't know that. That's a really helpful tip. There's a lot of really good information that we covered. And as I mentioned earlier, we will link to the American Heart Association's website so folks can follow up on heart healthy diets and those simple 7 tips for heart healthy living. Thanks so much for speaking with us today. I had a really great time talking with you.